All right, good afternoon, everybody, and welcome to our March 2023 Lunch and Learn. My name is Adam Prizio. Ted Doolittle, the healthcare advocate, is not able to be here right now. So I'm going to give you first a little introduction to our office and what we do, and then we're going to talk about today's topic, which is facility fees. So we are the Office of the Healthcare Advocate. We're a state agency. Our history is that we were created by the legislature in 1999 as the Office of the Managed Care Ombudsman. That name was changed in 2005 to the Office of the Healthcare Advocate. We are a small but mighty staff of nurse consultants, attorneys, paralegals, and other professionals whose job it is to assist Connecticut consumers with healthcare and health insurance needs. So for instance, the classic case that we might get would be if your doctor orders a procedure and your insurance doesn't think that it's medically necessary, they don't want to pay for it. They send you a letter that says, you've been denied. And in that letter, it also says for assistance, you can contact the healthcare advocate, which is us. We provide these services free of charge to the consumer, and we're here for you. Ted likes to say that we're the best kept secret in Connecticut. So if you or someone you know is experiencing a problem with their health insurance or with getting healthcare paid for, enrolling in healthcare, please give us a call. Our number is going to be on the last slide of this presentation and also on our website. So today we're going to talk about facility fees. This is something that comes up quite a bit. We hear from consumers with all sorts of insurance about facility fees that they didn't feel were fair. They were not expecting to pay. Sometimes these are new fees, and we'll talk a little bit about what's going on with them. So first of all, what a facility fee is, and I've got to move my my little finger here so that I can see the whole slide. A facility fee under Connecticut law is any fee charged or billed by a hospital or health system for outpatient hospital services provided in a hospital-based facility that is intended to compensate the hospital or health system for the operational expenses of the hospital or health system, and that is separate and distinct from a professional fee. So that's not, if you go and see your doctor, it's not the fee that your doctor charges, it's the fee that the place where your doctor is charges for everything that it needs to support. Assuming that your doctor is a member of a hospital or health system. I want to talk a little bit about the economic picture of facility fees. These are not a small portion of our, what patients talk about. Patients seem to really note the facility fees. So this is some data from it says OHA, but it should be the Office of Health Strategy. That's an error of mine. The Office of Health Strategy does a facility fee trend report. This is their report from 2021. Which goes through the year 2020. You can see that facility fees, total net revenue in Connecticut was sort of trending slightly upward for most of the last decade, around between $413 million to $437 million, with a decline in between fiscal year 19 and 20. Due to the due to the pandemic, which resulted in a lot of health services shifting over to telehealth, where facility fees cannot be charged. So for context, statewide hospital patient revenue in 2020 was 11.9, nearly 12 billion, according to an OHS annual report. And I'll note with that number that it's not clear to me whether the hospitals in that OHS report are the same as the hospitals in the facility fees report. I believe that there's strong overlap, but I was not able in the time that I had to prepare this presentation to confirm that they're exactly the same hospitals. I wasn't able to find this data for Connecticut, but Massachusetts had an interesting slide. The Massachusetts Health Policy Commission produced a cost trends report with this chart in it that I thought was interesting. So these are Massachusetts prices, but they reflect for 4 different common services. They reflect the difference between the provider's charge, the what's called the professional charge here, which appears in dark, like navy blue, and the facility fee, which is the charge that the facility is assessing. So you can see that in every case, the facility fee is more than the professional charge, and in several of these cases, it is considerably more. So I thought that was an interesting little eye-opening graphic that, we hear a lot about and we talk a lot about the healthcare prices. It seems to me that these facility fees might be a point that's worth looking at when looking at how to reduce what you pay and how to reduce what everyone in Connecticut pays for healthcare. Go to the next slide. So how to avoid, this is the question that we get a lot from consumers, is how do I avoid paying these facility fees? And the answer is in the legal definition, right? The definition is any fee charged or billed by a hospital or a health system for outpatient hospital services. So if you are able to avoid going to a hospital or health system, if you're able to find an independent provider, you will avoid the facility fee. So that's unfortunately that may not be the case, right? You may not be able to avoid, there's been a lot of reporting. Everybody knows that these hospitals and health systems are consolidating and they're buying up small and independent practices. And so it is increasingly difficult to find an independent provider. And that is a problem for people. But this is the only way that I'm aware of right now to avoid paying a facility fee. Connecticut does have law on facility fees. That law is primarily about notices. It's primarily about telling you about facility fees. So the law is Connecticut General Acts or Statutes 19A-508C. Section B of that law covers hospital or health system charges for procedures that use a CPT-EM or AM code. Those are evaluation and management or assessment and management at a hospital-based facility, right? So that's at, I believe the definition there is at or adjacent to an actual hospital. They must provide written notice of the following. The notice is that they charge a facility fee. They have to give you the amount of your potential financial liability if they know it, or an estimate of the patient's liability based on typical and average charges. They have to give you a statement that your actual liability will depend on the services that you actually receive. They have to let you know that if instead of going to the hospital or the hospital-based facility, you had gone to an independent facility, you would likely pay less. They have to give you a phone number to call for additional information, and they have to let you know to contact your insurance if you have questions about your coverage. For a hospital or health system that charges a facility fee for a procedure without using a CPT-EM code that's outside of a hospital campus, they have to provide a smaller notice, but similar information. They have to tell you that they charge a facility fee. They have to tell you that you may have to pay more than you would pay if you went to an independent non-hospital based facility. They have to give you a phone number to call for extra information, and they have to tell you to call your insurance if you have questions about your coverage. I'm not going to go through the whole bill. I just picked a few sections. The next one, people typically call us when they get a bill, right? They don't call us when they're at the hospital for the most part, about facility fees. They get a bill, and the bill has to do these things. It has to identify the facility fee, and this is the initial bill, right? So if you don't pay it and in 30 days they send you another one, they don't have to include these things. But the initial bill has to identify the facility fee. It has to provide the corresponding Medicare facility fee rate or approximate rate. It has to include a statement about what the facility fee is there for, which is to cover the hospital's expenses. It has to inform the patient they could have avoided the facility fee by going to an independent provider. And it has to tell them that they can request a reduction of the fee or of any other portion of the bill and give them a phone number to do so. And that typically is where we get involved. And in my experience, generally, that is solely in the nature of a request, right? There's usually not a lot that we can do to demand that a hospital or health system reduce its facility fees, but we can request it. And sometimes that request is given. When do you have to get these notices? The notices prior to care. If it's emergency care, then the answer is as soon as it's practicable, right? So they first are going to stabilize you, or if you're unconscious or not able to understand your rights, as soon as practicable they give it to your patient's representative. For non-emergency care, if the appointment is scheduled more than 10 days out, then the notice has to be mailed. If it's scheduled less than 10 days, then the notice is supposed to be delivered when the patient presents for their appointment. And I have to say, I don't think I've ever seen a notice come in the mail. Typically, and that may be because people, throw away their mail or forget about it. They open it and they say, yeah, whatever. It may be that people aren't getting them. I don't know. But when I've asked a hospital for, hey, can you prove that you sent this notice? They never send me a statement saying we mailed it on such and such a date. They always send me the disclosures that people signed when they got there. It's signed and dated, and it includes somewhere in it the information about the facility fee. There is upcoming legislation. This is kind of exciting. The governor this year sort of put out legislation which the legislature has taken up, which is an act protecting patients and prohibiting unnecessary healthcare costs. Among other things that it does, it will prohibit hospitals and health systems from charging for a facility fee for services that are outside of a hospital campus, a freestanding emergency room, or a facility that contains an emergency room. And so this is, I think, meant to address the complaint that we hear a lot at OHA, which is, I've been going to my doctor for years, or this practice group for years, and they just got acquired by Yale New Haven or Harvard Healthcare, or one of those are the two big ones that are in my mind, but one of the hospital-based systems, and now I used to pay $80, and now I'm paying $300 because there's this facility fee, and that's because when they get acquired, they're no longer independent, and they're entitled to charge that fee. This bill also contains some additional provisions to study and address some rising drug costs, to look at the practices of some of the middlemen in the pharmacy industry, which are called pharmaceutical benefit managers, as well as looking at the hospital consolidation process, which is called the Certificate of Need, where hospitals are allowed to acquire or shut down other hospitals, and things like that. It's not law yet, and it may not be law unless the legislature passes it and the governor signs it. So if this is something that you feel passionate about, I encourage you to make yourself heard to your legislators. The bill number is 6669. And that concludes my my part of the presentation, at least. So I always like to end by saying that we are here for you. We are, as Ted likes to say, the best kept secret in Connecticut. So I encourage you to give us a call with your questions, send us your questions by email. As I say, it's free of charge. We are here to assist you with navigating your way through this healthcare system of ours. So with that, I believe I have a little time for questions. So if you have questions, stick them in the chat, and I'll ask Denise to facilitate that for me. Thank you.
Are there any questions at all? Don't be shy. If not, give us a call, as Adam mentioned, or email us at healthcare.advocate@ct.gov. We are here to answer any questions or help. Thank you for coming to this session, and have a great afternoon, everyone.
Thanks for coming, everyone. Have a great day.
Thank you.
I think
Oh,
so. Oh,
thanks.
no. Bye.
Bye. Thank you.
Have a great day. Bye.